Just a minute. Sorry.
Okay. Hi, everyone. Welcome to Real Talk Chronicles. I am soon to be joined by Bill Foster in about 2 seconds, and Dr. Mack just had to step away. I hope everyone had a wonderful weekend. We had some incredible weather this weekend. It was quite hot. I actually was outside most of the day, Saturday and Sunday, for our art festival. So we did our very best to stay as cool as possible. It was quite intense. Theresa, it's really good to see you.
Likewise.
How
Likewise.
are you and your
I'm good.
family?
I'm very good. Thank you.
Everybody's good. It was such a treat to have Jay on with us last month.
Oh, good. We'll get him back.
Yes. Hopefully we didn't scare him away. He's
No.
okay.
It crept up on me for today, so I didn't even remind him. So
Oh
that's what
yeah.
I need to just put that it's the fourth Monday.
Yes.
Yep,
Yeah.
I got it.
Yes.
He enjoyed it.
Oh, that's good. That's good. That was a nice treat.
Mhm.
That's one thing that Bill and I had talked about, because the sessions with you and also Dr. Porter are so informative. It's just very helpful for people to write in and ask their questions, and we do
Well,
appreciate
good, good,
it. Yeah.
good, good. Okay.
So, Teresa,
Mm-hmm.
I was just talking about the heat. I don't know,
Oh,
but my mom and I did the art festival in
uh-huh.
this weekend, and I think I heard the forecast. They said that it was like the upper 90s, but it felt like 102 or 104 or something like that. And
Mm-hmm.
I
Mm-hmm.
truly believe it. So, yeah, my experience was, try to hydrate as much as possible. And I actually have a pair of I don't know what they're called, but they look like headsets. They go
Uh-huh.
around your neck, but it's actually a cooler, an air cooler. Have
Oh,
you
I've
seen
seen
those?
those. Yes.
I actually have it
Well,
right. Yeah.
let's
So
see.
luckily, I
Yeah.
have two of these.
Uh-huh.
One for mom and I, and every now and then, I would charge it up good, and I would just come up behind her and put this around her neck and turn it on. So she's
Yeah,
so
no, that is great. But we're
yeah,
thinking along the same lines because
good.
it was so hot. I really wanted to go over things for these
Yeah.
heat related illnesses. Okay.
Yes. Yes.
And
Yeah.
talk about them. And so the first one is the more serious, which is the heat stroke. And you can feel it because your skin gets really hot and you have damp skin and your pulse can be beating fast and you can get dizzy and you can be confused and
Mm,
really you could pass out. And so if you ever come across anybody like that, that's a 911. That's a heat stroke. And you try to move the person to a cooler place.
mhm.
And you could put cold cloths on them or try to, if they haven't passed completely out, um, a cool bath, but you don't give them anything to drink.
Mm,
And this, especially when we get these heat waves, and it's bad when they're talking about cooling centers for everyone, and if your air conditioning isn't working, so
mhm.
it can really be serious. That's heat stroke. Heat exhaustion is almost like the same thing. You can have some of the same symptoms, but your skin, instead of being hot, is going to be cold and what we call clammy. It's got sweat. You can have muscle cramps. You can have dizziness, and again, you can pass out. And it's loosening your clothes.
Mhm.
Try to move to a cooler place and put wet cloths on and sip water. So,
Mm,
Lika, you had it right when you were out like that,
mhm.
is to really stay hydrated. But it gets serious if you start Hi, Mr. Foster. How are you?
Hey, how are you?
Okay. It really gets bad if you start to throw up and any of those symptoms that get worse or last longer than an hour. You need to be calling 911.
Mm.
And then heat cramps are you do a lot of sweating and you get the muscle and muscle cramps or muscle spasms. um, and usually you'll be doing something, so you might have been outside playing volleyball or even swimming or doing some activity, and then all of a sudden you get that cramp again. It's drinking water or this sports drink. For the heat cramps, you can give them something to drink, and it may be a couple of minutes before it actually goes away. But if it lasts longer than an hour, you have to call 911. And this could be bad also if you already have a heart disease. Somebody said, I wish people would just put the air conditioner on and not simply stay hot. That is so true. But a lot of people, they prefer not the air condition or the artificial air, but it's cool. The other thing you could do is stick your head into your freezer of the refrigerator.
Yeah.
You know, Theresa, it's so funny. First, hello everybody. Apologize for being late. But you know what's so funny? The older generation was so big on conserving money. Oh, I don't want to spend money. I don't want to pay my electric bill to be this high. And I know my mother was one of those individuals. But like you're saying, when we're talking about this heat, the way it is now, listen, it's better to pay that money than have a little heat stroke, because there's so many variables of people being sick right now, enough is enough.
Yeah.
We have to make sure that the bottom line is we are let's kind of get out of our old habits and just listen. Put the air conditioner on and knock it off.
Yeah.
You know?
And it was I'm trying to think, somebody, you had just said the cost. And I was talking to a patient today, and he was saying, I just sit in the house, and when it's hot like this, because I don't want to put the air conditioner on, but he will play the games. And I said, well, what games? And he started naming them. And he said, but my bill is too high. And so I don't, excuse me, want to use the air conditioner. So again, that leads us, or it might be a clue that we need to find out how are their finances.
Right.
Was sorry.
No, it's all right. It's all right.
And then the other one I wanted to talk about was sunburn. And so again, Blacks can get sunburn. And so again, it's your skin is red and warm. Oh, excuse me for one minute.
Take your time. Everybody, this is Real Talk Chronicles. I'm here with my co-host Malika and Dr. Theresa Mack, and we're talking about strokes and due to this heat wave. Shout out to everybody who's chiming in. I see my cousin Marisha's in here. A lot of other people. George, Stefania, I sent you Dr. Corder's email via IG just for you guys, so you wanted it. Everybody, listen.
That heat this weekend, Bill, was brutal. I was telling Dr. Mack, Saturday was worse. Saturday was worse, but everyone moved at just a very slow pace.
Yeah.
And I set up our booth at like 8:00 in the morning. It's nice and early up there and get it done. Not even halfway through, I was like, I went in the AC and just sat still for like, I don't know, maybe 20 minutes. Because we don't need any kind of problems like that, and it is sad that people who are, there are a lot of people who are concerned about their electric bill. I mean, we all talk about bills, utility bills. The price of everything is going up, but it's sad when someone puts their health at risk, for the sake of a bill.
Yes. So for those, please out there, check on that older generation that are or were like my mother, that was like, oh, I'm not going to put my AC on. I don't want to pay that bill. There's some people, they'll play that fan maybe, or they may not even use that. They'll crack the windows with no air coming through. You know what I mean? And we have to just check on them, because the bottom line is they don't know better now. You know what I mean? They're still stuck in a prehistoric way. So we have to do that. And like you said, with the way the heat is right now, and strokes and things that are happening so fast, and with the weather, it's just unbelievable right now. It's unbelievable. Yeah.
So did we get any questions coming in?
Not yet, but I'm really curious to hear what you're going to say next about the sun.
Oh, okay.
I call myself a sun worshiper, so
no. There's nothing wrong with you going to the beach and being out there, but you got to take the precautions, right? So it's that you need to have your cold water, have your ice. Even when you're out on the beach, do you have an umbrella?
I do, but I'm known to not sit under it for long periods of time. So I've been scolded about that. Yes.
Okay. No, I mean,
because God, it's so funny that people go to the beach, but then I guess it's like an oxymoron, right? Like it's like going to the pool and don't get in the water, like. So, I mean, people go to the beach, they want that sun. So what are the preventive maintenances, the things that they can do, like lotions or suntan? I mean, I'm not a beach person, so you ain't got to worry about that.
We all know.
I get a suntan.
I remember the last time Malika was saying she would go to the beach without you, that you weren't a beach person.
Not at
but
all.
Again, even when you're sitting out, you can feel yourself getting hot and uncomfortable. That's a clue for you to either come inside, go under the umbrella, take your cold towel, put it on your face and your wrist, and drink lots and lots of water.
Yeah.
Does it make a difference if it's just water, or is it flavored water? Is just
No, it doesn't. Even the sports drinks, you have so much water, and some people think that it's better because you have the electrolytes, but it is just good to continue to drink as much as possible.
Doc, can you explain to people why everybody in the medical profession always says alcohol is not good in the sun? Can you tell people why that?
Well, it's because it dehydrates you. Okay. You'll get dehydrated quickly. And sometimes even when you're inside and you're drinking, don't you feel warm? You get a warm? No.
Yeah.
And so it intense.
Yeah, I thought it was because I had to pay the tab, but
oh my goodness.
I'm just playing. You got to throw some humor in there. I know what you're saying. Yeah. There are times when I guess I have partaken in some beverage, and at a certain time, you start feeling a little hot. Even at night. You know what I'm saying? Sometimes, like, okay, wait a minute, like, oh, but I think like there's always precautionary measures to what you have to do or shouldn't do. And
I think the fan that Malika has is a great idea. Okay.
I love this thing.
Yeah, man.
This is my first time using it, Theresa, last weekend. I've had it for I don't know how many months now.
Months or
It's
been months, right? No, I don't know.
Yeah, I bought it somewhere. Yeah, a good friend of ours, Michelle, she wore it last year. And I
Uh-huh.
was curious about it. And so as soon as I found it, wherever I bought it, I'm like, oh, I'll take 2. You never know,
Mhm.
right? And so I should have gotten 3, but maybe you'll just share this one with me, Bill. Just try it.
And
You don't have to
I'm
do all
looking at you. The other thing is the cat. Okay, you
that.
you can, that does protect you somewhat. So when you're in the sun, do you have that on or no?
A lot of times, yes, I do. Yeah,
Okay.
a lot of times I do. Yeah. All right, you can take it off now. I just wanted to
I'm not gonna
demonstrate.
break it, right?
No, I wanted to demonstrate it's one size fits all.
Uh-huh.
And in the head,
You're such a good trooper.
I'd have been like, I had claustrophobia with that thing gripping me
please,
around
don't
my
be
neck.
dramatic. I have something else for you, Bill, that may work.
Oh, that's cute.
You
I'm
may
not
like this
going to the beach, so it doesn't make it their friends.
Uh-huh.
Sophia had a statement, a question. Go ahead.
Yeah, she's talking about the kid that got pulled out in the riptide. I did hear that.
Oh,
Oh gosh, that's so sad. Miss Francois
yeah.
said that a teen went swimming and ay.
When you say what are the signs of one should get out the water, and you're talking about in regards?
Well, when the tide takes you out there, I mean, that is
well, that's nothing.
Riptide.
That doesn't have anything to do with a heat stroke or anything.
No, that's
Right,
a whole other
right.
topic.
Yeah. So finally, we're gonna have to come on.
Yeah, I saw it. I was just waiting until we finished this conversation.
Okay.
Because the bottom line is that's what.
and
I'm showing Theresa I'm prepared this year. So
what
this
is the heat
is
stroke
a
that's going
fan.
on here?
This is a fan that you just wear around your neck, and the power button. I don't have batteries in it. My batteries right here.
Oh,
But
so
yeah,
that's good. So you have the neck
Mhm.
fan, and then you have like a necklace fan.
I am prepared.
Yes.
Yeah.
Okay. I'm writing these down so I can at least tell some of my patients.
Yes. This
Okay.
is the box that the neck fan came into. It says O2 cool.
O2 cool. Okay,
Yes.
great.
So I'm prepared.
So when the question was when they go under. So the thing is, it's that rip tide that's you can't see it. It's pulling them, and so people always say that you should swim parallel to it. If someone is going under, what should others do? Unfortunately, unless you are an experienced swimmer, you've got to get out and get help, okay? Because there's nothing really you can do, and you will be going under. So that's a difficult thing. And what you have to be careful about is, even though people may swim in a pool, the beach is different. And we have to caution people this year, because of global warming, that these sharks are coming up even in waist deep water. So you need to be able to see the water so you can see if there's anything here. But I will, Miss Francois, I will ask the emergency room doctors what other things they suggest, and I can bring that back to you the next time.
Well, you know what? I'm gonna piggyback off of that and just say, if God forbid somebody has some kind of drowning situation, what should somebody do medically or health wise? I mean, I've done CPR and stuff like that. I got 100 in it just a couple of times too. So I just want to know. But what would somebody do? God forbid somebody I think we talked about before I came about what somebody should do if they had a stroke or something out in the street.
We're talking about heat strokes.
Heat strokes.
Yeah,
heat
right.
strokes.
But God forbid go ahead.
No, if you see someone and they're struggling, or more often than not, they're struggling and then they just give up, that's the time where you will do CPR and start in the water, just trying to resuscitate them. That's about the best you can do, and you call for help, and or tell someone to get 911. And that's one of the reasons you don't really want to be isolated on these beaches or hiding behind the rocks and just gonna go and do your own thing, is because you want people to be around. And the lifeguards are there to look after you, and you'll see them sometimes. They'll run in, but they have that little pad that they can reach out, so somebody could grab on if it looks like that they are in trouble. But yes, it would be starting CPR in the water. But you're, let me see, I keep a bottle of clear aloe in the fridge to rub on the skin. Okay.
All right, go ahead, Vera, with the wonderful last name. Yeah.
Okay.
Yeah,
all right.
So okay, Vera, you keep it in the fridge. What does that do? And Doc, I don't know if you can help her out with that, or before she explains. What does that do? Because it has a chill to it. Does it? Like I don't know what it does.
Or does it make it last longer? Maybe.
Yeah.
Let me look it up real quick, because and where did you learn that, Vera?
Yeah. Or is that something Grandma told you on the porches or wherever you're from? You know what I'm saying? The worst thing.
Okay. So it says here the reason is that it will protect you against burns and radiation and any damage to the skin. So it would be a cooling effect. And they say, wait a minute. Yep, for cuts, thermal burns. Okay.
All right, Vera. Thank you. That's what's up. Vera with the wonderful last name, right?
Yes.
Okay.
So
cool.
yeah, I have heard of the aloe vera gel, or you can get the aloe plant, right?
From the plant.
Yeah, from the plant as well. We have one downstairs if you ever need it, Bill.
Where's it at?
It's right outside the kitchen.
Oh, is it? I don't know.
It's the little plant. You got to pay attention to the plants in the house, Bill. And Harold, I did see your stop shaking your head at me. Your message. I heard that on the news. They definitely say don't fight the riptide. Go with it. Imagine that, but go with it. And when you don't feel yourself being pulled anymore, then they said to swim against it. I heard that on the news just the other day.
Hey, Doc, let me ask you a question. What's a stroke? Is a heat stroke different than a regular stroke?
Yes. A regular stroke is that you've had a cut off of the blood supply to the brain. And depending on where that cutoff comes from, whether it could be a plaque or a cholesterol or some protein, depending on where it is in the brain, it can affect your arms, your legs, and your speech. That is what we call a stroke.
Okay.
A medical stroke or cerebral vascular accident. A heat stroke is that your temperature, your core body temperature, gets so high that it really is like shutting off the processes that normally you could do. It's like you're being cooked. And so that is it's two different mechanisms. But the heat stroke is just as deadly, and you got to get the person out of the sun.
So let me ask you a question. Can a person, I'm sure, suffer a stroke in the heat and it be a regular stroke in comparison to, like, how would they know the difference? Because the bottom line is a stroke,
Okay, well, the heat stroke, you're going to really feel hot. And you'll have the dizziness. But it's, say, for instance, if a person did have what we call a CVA in the sun, there would be some overlap because they may be dizzy. They may throw up.
Mm.
Their skin could be warm, but it's not at a level that it would be the same as as the heat stroke. But yes, you can have people who have a heat stroke. You can have seizures, and you can have just a regular stroke.
Wow. Wow. Um, I think you just said about the severity of a heat stroke into a regular stroke, but um, that word stroke is a stroke, right? I mean, it's just, I guess, a different stroke,
How it comes about.
how it comes about, right? Like the recovery.
Yes, when we say stroke, it is something that has affected the normal mechanism of the body. So for a regular stroke, that would be the blood supply is cut off. For
Mm-hmm.
a heat stroke, that means your internal temperatures aren't able to keep up, and your whole, it's like your internal thermostat just shoots straight up like mercury. So
Mm-hmm.
it is um, it's like a derangement or an abnormality. Okay, and that's what we mean by stroke. So you can have heat, you can have just a regular that could come from, like I say, a cholesterol plaque. If you have a heart arrhythmia and your heart is beating erratically, it can throw off blood clots that can pass through your brain. And that is the most common when you see a young person who has had a stroke, a cerebral vascular accident, and they come in, you can pretty much be assured that they had some kind of heart arrhythmia, didn't know it, and then that allowed the blood to clot, and then pieces broke off, and then they traveled to the
So
brain.
Interesting.
yeah, that's deep. Does this have anything? Is this in the family of when somebody says they have like arteries, like blocked arteries, or anything like that, or something like that?
That's exactly it. And what um, doctors and primary care is about now is trying to find out if your arteries are blocked and what percentage they are blocked. If you have, and blocked means that it's usually the cholesterol plaques that line the arteries. And what we say about cholesterol is that you have a total cholesterol count, you have what's called a good cholesterol. And that good cholesterol is what we call the HDL, a high density. And then the bad cholesterol is a LDL, the lower density. And so if you have a lot of LDL cholesterol, those are the ones that will line the arteries and will just keep doing it unless you start to change your dietary habits or you take a medication. And so once those get completely blocked, or they're blocked such that when you try to do any type of activity, there's it's like a pipe that's got all this grit, water can't go through. And so that is what people are talking about with clogged arteries. And we do have ways that we can see how those arteries are clogged and what is the percentage. Now, the one thing I like about knowing your cholesterol profile is that HDL, the good cholesterol, what it does is it takes that bad cholesterol that is in those arteries and takes it to the liver to be destroyed. So you have to look at the whole picture to see if the cholesterol proportion, if you have high, good, that's very good. And if you have low, bad. Um, And the way to get high density or good cholesterol is to exercise. Okay, there's only one medicine I think that I have to look it up to make sure that there's not others, but we don't even use it anymore. It's called niacin. I mean, we do use it, but it has, let me see, it raises your good cholesterol. But mostly we tell people exercise.
Seems like
Bill, I'm sorry, Bill.
Exercise is always a common denominator. Everybody, this is Real Talk Chronicles. This is Real Talk with Dr. Theresa Mack and my lovely co-host Malika Forster. We are in the Real Talk segment. And you got questions for the doctor? Ask her before she gets out of here. She has to make a hard right at before 8 o'clock. So we got about 25 minutes the most. And if you have questions, please, we're talking about anything and everything. The doctor is here to give you her expertise on what she feels that you can do to make yourself a better person, health-wise. And listen, ask the questions. The bottom line is you don't get this chance. We're lucky that we have her.
So fortunate.
Yeah.
Oh no, I'm the one. This is great that you can kind of dispense to your audience. I'm having a ball.
Oh, that's good.
So I'm looking at the HDL. So they're saying that some medications, and niacin is one, but these others that they mention are regular ones. They don't really raise your good cholesterol. They lower your bad cholesterol. And they say losing weight, quitting smoking, and eating fatty fish like salmon and sardines can increase it.
Salmon can increase that, really?
Can increase your good cholesterol, the HDL.
Wow! Like
the good cholesterol.
Oh, okay. Because I was about to say.
I think we heard it wrong the first time. I was like, wait, not salmon.
No, it's good.
That's a good thing, right?
Yeah, because I was about
we both were kind of sad for a second.
I was about to say, "Dagnammit," you know what I'm saying? I had to go there. Yeah. Vanessa, what's up, Vanessa? It's always a pleasure to see you, sis.
Hi, Vanessa.
She says your blood pressure is connected to certain strokes, like a brain bleed stroke. Thoughts, comments, Doc, on that?
Okay, so there's two types of strokes. You can have the one that we're talking about with you have a clogged artery, but one that can occur when your blood pressure is so high, and she's saying hemorrhagic stroke. That's exactly correct. But I explain to patients that when your blood pressure is high, the blood is flowing through arteries. And as long as the arteries can expand like a rubber band, it's going through and you're pulling. And so you're pulling that rubber band. Just imagine if you did this millions and trillions of times, that rubber band would get weak and it would break. And that's what a hemorrhagic stroke is that the pressure has been so high that even though you were feeling good, it has weakened the walls of the arteries. And once it does that, it can be broken. And if it's in the brain, it's a hemorrhagic stroke. If it's in the kidneys, the kidneys will fail. That's acute renal failure. And again, that the arrhythmia that I was talking about before is atrial fibrillation, okay, which the heart beats so erratically that the blood clots, and then you break off little pieces, and that goes to the brain. And if it clogs up wherever that artery is, or wherever that particular blood supply is feeding that part of the brain that does the speech, does your motor, does your thinking, then that's where you won't get any blood supply, and that's where you will see a person, they can't move, and they can't move, they may not be able to speak, but those are some of the things that you get someone to the hospital immediately, because they can give them medicines that will dissolve that clot and prevent new ones from forming, and so they can recover from that.
Doc, let me ask you a question. I see you, George. Thank you for
Okay.
chiming in with us, George Moore. Can you, my question before we go to Harold's statement?
Okay.
Can somebody fully recover from a stroke, or are they suffer? Or they would be that way?
Sure, you can. It just depends on how much initial damage was done.
Mhm.
And if you are having a stroke and you're weak, if you just start to do the physical therapy or occupational therapy and move, it's like training a baby to do certain things, then yes, that can help. But you still need to be able to find out what was the cause and what things that you can do while you're there. But yes, it can, but it's not something that I can look and say, oh, okay, Malika, if you have a stroke, you're going to do well. And Bill, if you have a stroke, you're not going to do so well. It's not like that. It's internal.
Understood.
And Theresa, isn't it possible for someone to have a stroke and not ever know unless it's detected? Like it's called a silent stroke.
Yeah, and those are little small ones.
Right.
Okay, so you could have again a blood clot and it's going off, and you could just be tripping. Okay, and you're walking and you say, oh, the sidewalk's uneven. Okay, and actually those are little tiny clots that are affecting your legs, and if it's going to affect your legs, it can go anywhere.
Wow.
You know, it's so funny. We're going to read Harold's statement, and then shout out to Harold
and
Liz in the building. Yeah, some statements.
Mm-hmm.
I think back to the old Sanford and Son shows when, I guess in this segue into my question, how he used to always be like, oh,
Elizabeth, I'm coming.
Mm-hmm. Can stress cause a stroke?
Oh, absolutely. Absolutely. Because again, what happens with stress is you're releasing chemicals that may cause spasm to the big arteries and little arteries. And so, yes, and you have seen, it's so dramatic on television. Somebody gets on and then they do this and they pass out. But yes, you can do that. And I think one of the reasons that primary care is trying to incorporate mental health and behavioral health is because we see that if you're not taking care of your mind, you can't take care of the rest of your body. And so mental health has become a major thing in primary care. Things that I was mentioning, again, a patient I saw today, and we were talking, and he said, oh, something to the fact that he can't put that air conditioner on because it's going to cost too much and my bills. And that was like a trigger for me to start asking him, just, so what do you do? And he's playing games. And so what time do you eat? I'm trying to figure out, does he have food? Okay. And so it's just a way in primary care that you're trying to take care of the whole person. And the mental health and the behavioral health piece is so very, very important.
So sad. Yeah, let's go to Harold. Everybody, this is Real Talk Chronicles. That's Dr. Theresa Mack. That's my co-host. These are all my co-hosts. Dr. Theresa Mack and Malika Forster, and I am Bill Forster. If you have questions, please put them in. We have over a little 17 minutes left for the doctor because she has to make a hard right at 8. And we want to get all the questions in and comments and statements. So we'll try to get them in now. Harold said, what did he say? Health is wealth. HDL,
LDL, triglycerides, BMI are things that some people don't monitor enough. After I get my EKG, I also get an echocardiogram.
Right. And he's so that's such a true statement. I want to go back, and he said health is wealth, which was true. And he mentions the HDL, the LDL. Triglycerides are the fats that when you eat, those are the fats that take the fat to either the liver or where else does the triglyceride? They're like the carrying proteins of the cholesterol, and so they're important because even if they are really extremely high, and to give you an example, if you have a value and it's less than 200, then that's considered normal. But you can get diseases that will have it in the thousands. And you can also get triglyceride levels that are 500 and 600. And so when you see them that high, it can clog up your pancreas. And so you get pancreatitis or inflammation of the pancreas, which is a very severe and painful abdominal injury. And triglycerides, when we see that and they have pancreatitis, a lot of things can cause it. Drugs can cause it. Beer can cause it. And
beer?
So beer, a lot of beer. Okay. And so those are things that, we look at, and we will say your triglycerides are high. And so are you doing a lot of beer, or are you eating a lot of foods, or did you eat right before you took the test? And that's why sometimes they will tell you to fast for 12 hours, because you want those triglycerides to have taken the fat to the liver or wherever it is going to be stored, so that you're not measuring the triglycerides that are actually in that food stuff that you ate.
Understood.
He also mentioned BMI, which is body mass index, and that is it has a lot of problems, but in terms of, it doesn't take into account big boned people. It just looks at your mass index, that to fat. And so, but it's a good way for right now how we measure things. And a BMI of less than 25 is normal. And so when you go to the doctor, they'll do your height and weight, and then it gets converted into a BMI. If your BMI is between 26 and 29, we say that you're overweight. And when we see that, that's a clue for us to talk to you about your diet and what are you doing, or increase your physical activity so that you can get your BMI back down to normal. When it's over 30, that's the term that we say is obese. And we don't like to use obese anymore, or if it was a BMI of 40 or 50, that could be a person that weighs 300, 400 pounds, and they say morbid obesity. That sounds so horrible. And so we now classify, we just say a BMI of 50, a BMI of 40. It's still telling us the same thing, that we have to change our diet.
So let me ask you a question, doctor.
I think some of those scales are wrong.
Yeah, I have a statement and a question. You know, when you were younger and when you was a little chubby kid, they would call you husky. So like, is that kind of coincide when somebody's saying a big boned person? Because what's the
Yeah,
difference?
I mean, it does. Let me
If you're
wait a
fat,
minute. I'm going to
you're
pull
more
it
chubby.
up. BMI. It has no. It doesn't take into account a person's bone structure. And so we could be standing side by side, and I'm perfectly okay in terms of my BMI, but you see someone else who looks like they have more muscle, then their BMI may be off. And so
Right.
you have to take into everything. But the BMI, let me see if I can find the controversy.
Well,
Wait a
as you
minute.
do that, and also too, I want to ask you, it was in regards to these charts on what your weight, your body weight should be due to your height. And you know, no disrespect to our Caucasian family and friends, but the bottom line is, I've heard so many people always say of color, say, "Well, that's not my weight. I can't be that weight. That's for the Caucasian
But
people." Is
yeah,
that
no.
a fair statement, or is that just off?
No, that I would say that's accurate.
Okay,
They're not. That's why I started out by saying the BMI is not a perfect tool, but it does help us for what we need to do. Now you can say that, say for instance, a person. Let me just use you and Malika.
mm-hmm.
How about if your BMI? Now both of you should looking at you. Your BMI should be normal, or maybe, Bill,
Yeah,
maybe
yes,
above 25 or 26.
understood.
But if that's the case, then you would say, if that is your BMI, I could have someone else that's right next to you who might be big boned, and
Mm-hmm.
they would weigh more, okay, and their level of fat might not be that big, but their BMI is higher. And
Yes,
so it's not, you have to look at the whole person. And so
understood.
I have patients that I'm explaining 26 to 29, you're overweight, and they may have a BMI of 30, but they're perfectly, all their blood tests is normal, they exercise, then that's where we are. And so you have to look at the whole picture. But
Wow.
if you got down to some of those charts, um, we always say that wasn't meant for us, because a BMI of say 20 or less than 25, and you're like 90 pounds,
Yeah, exactly.
that's not us, okay?
No, no.
And so it's not a perfect tool, but it does give us some information.
Yeah,
And he also mentioned the EKG, which is measuring the electrical activity of your heart. And we can detect abnormal rhythms. You can detect heart attack. You can detect if the heart is large, any part of it. And it's based on 12 frames, and each frame is taking a picture of the heart. And
right.
so that gives you a lot of information. But he mentioned an echo, and that echocardiogram is a sonogram. And the sonogram of the heart gives you actual pumping action of the heart, so you can see how far or how fast the heart is going. And if someone had a lot of cholesterol or a lot of clogged arteries, that pumping action would be lower, and lower is not good. Pumping action is not 100%, it's 60%. So if you did an echo cardiogram and they said that your pumping action was 60%, that's normal. If it's under that or between 50 and 60, we could say that it's reduced, okay, but they're still able to function. And so he's right that people don't talk about these things, and they are just as important. It's again, it's part of primary care. What is the doctor going to order for me? Or should I go to the doctor and say, oh, I need an EKG. And then when they read it to you and tell you what it is, do I need a sonogram?
Yeah. You know, I think my man Harold, I'm gonna tease him. I'm just gonna say this in jest. I think he like try to get an echo or EKG every 3 weeks or something. Every time I turn around, he'd be like, I got an echo, I got this. You know, we got a lot of questions and statements. Everybody, this is Real Talk Chronicles. I see my boy Nubian Styles in the building.
That was great information, Theresa. I've had that done as well. And that was an interesting process to
Marlene has a
experience. Question. But I want to address Marlene's. She said, what can be done about increased heart rate during menopause? Would hormone replacement help the palpitations?
Okay. So with menopause, that means we have decreased estrogen production. And we're finding out now all the things that estrogen did. So when we were younger, we just took things for granted. When you go through menopause, you're like, I didn't know all this stuff was related to estrogen. So some people have hot flashes, and there was another question about that. Those hot flashes are not heat strokes. They make you feel hot, warm, and you have to take off your clothes or throw cold water, but that's different than any of the heat injuries that you get from what we were talking about earlier. When your heart rate increases during menopause, you have to be evaluated for that increased heart rate, because you just don't want to say it is due to menopause. It could be due to menopause, but it could also be due to something else. And so again, the EKG and that echocardiogram would give us some more information. And would hormonal replacements help the palpitations? What you have to realize with just estrogen is that if you give it by itself, it may cause breast cancer. So usually you give estrogen with the other hormone called progesterone. And if you don't, or if you can't tolerate it, then there are other things that you can do. I usually have my patients talk with their gynecologist about the different hormone replacements. You can also have plant estrogens, and that's what's on the health food stores, the Estroven, and that seems to work and doesn't have any side effects that we know of now. And so would hormone replacement help the palpitations? Yes and no, because if you have risk factors that you really shouldn't be taking estrogen, for example, you've had breast cancer or you have a first degree relative that has breast cancer, I wouldn't recommend estrogen. But how would you treat those palpitations? Do they occur? And we have to get more information. Do they occur all the time? Or are they occurring just when you're sitting down? Or do you notice it when your breathing is labored, like in asthma? Those are things we would need to know to see. And I wouldn't treat estrogen for palpitation unless the GYN, your female doctor, says we've tried other things and I think that this is it. Most palpitations are being treated by drugs that are called beta blockers, which slow the heart down. And I want to say that those drugs that slow the heart down, those are not drugs that you want to give someone who you're telling to exercise, because you're giving them medicines to suppress the activity of the heart, and then you're telling them to increase it. So it's not just a simple answer. Can the hormone replacement help the palpitations? That I would say that's a conversation you want to have with the GYN doctor.
Sweetie, you want to read some questions? Because I know we only got about a couple of minutes for the doctor.
Yeah. Harold, andropause? I've never heard of that.
Yeah, you know what? That's from Mr. Harold. Mr. Harold, I'm gonna have to get some information on you, and I hope you're here for the next fourth Monday, because I'll have that. I'm writing that down now.
And Vanessa, I just wanted to let you know, I'm not sure if you can see my response, but I'm just so glad that it was caught early for you. And yes, prayer definitely does work. Marlene said, thank you.
What was that definitely does work?
Vanessa, let me go back.
Now I could see some of the comments today. I can't see that one.
No, this was
Vanessa. I was a type.
No, this was about the sharks. That was not that.
Okay,
it was another comment. Sorry, Vanessa. It was a lot. I wanted to, or you can write it in again.
Yes. Vanessa, we were actually saying that with the global warming, these sharks are coming up to, or fish that bite or whatever, are coming even in waist deep water. So you do have to be careful. Is blood pressure, what was that?
We were talking about the stroke. That's what.
Okay, that was her comment. Okay.
I know it was there somewhere. So yeah, she said that it was caught early. Thank goodness. Harold talked about how he also eats his water. Good boy, Harold Hatter.
How he eats his water?
Yes, cucumber, celery, watermelon.
Okay, all right. Oh yeah, but that's a healthy diet. That's fruits and vegetables.
Yes,
okay,
absolutely.
excellent.
And Stefania, there were a couple different things that you mentioned. That it's 8 o'clock. That's what I was just writing, that we're not going to be able to get to these. But it was something about some kind of fungus, ringworm, polio, measles. Yeah.
Okay, wait a minute. I'm not. Apparently, there's a new STI that's a fungus and present like athlete's foot. I'm gonna have to look that one up, Miss Francois. I'm gonna write it down because I don't know. I haven't heard about that.
So, Miss Francois, we're giving you a homework assignment to come back with these questions.
Come on, Stefania.
Yeah, because we don't want to lose them. But yeah,
I wrote it down. We could lose it. I got it for next time.
All right.
Work for us. Okay.
Okay.
That was it. Yeah.
Well, yeah, Doc, I know you got a meeting.
I got another meeting, and
listen, I love the hair. You looking just
it's cute.
Thanks. You know, it's hot.
It looks good on you. Exactly.
Push it up. Especially when I heard that temperature. But thank you.
I got to push it up too. So listen, Doc, got to give us some positive affirmation before we get out of here. It's always a pleasure. We'll see you on the next fourth Monday of the month. What else are we gonna say?
Okay, so I want people to know and to enjoy the sun like Malika, and just be prepared. We talked about the couple of the fans, the cloth, the ice cubes, things like that. Just enjoy the sun, but stay safe.
Thank you.
Exactly.
And I just want to say, as our good friend / brother George mentioned earlier, being a caregiver for the elderly, it's all this information is great for everyone, but especially someone who's keeping a close eye on an elderly parent.
Yeah, you please got to keep an eye on everybody.
Mm-hmm.
Doc, it's always a pleasure. We will talk to you soon.
Likewise.
I'll have
All
some closing remarks, but I know you got to go. So please.
Yes. Thank you. We'll talk to you soon.
I'll talk to you later.
Yes.
All right.
All right. Thank
Bye-bye.
you.
Bye-bye.
Thank you.
All right. Bye, guys.
Bye-bye.
Everybody, listen, it's so funny, Real Talk. We're trying to, I'm going to get a dentist. It's been in the works that I'm going to get a dentist on the show, and he can talk to you about your mouth, because I know some of you got some shit going on with your mouth. And I'm just saying, but
no, can I tell them, please?
Yeah, tell them the story.
Yeah, so Bill went to a specialist in the area, and highly recommended by his mother-in-law. And Bill, I mean, you're just so personable. He came back friends with this dentist, this highly specialized, wonderful dentist. Yeah. And he refers to him now by his first name. He's like, yo, yeah, Eric and I.
That's my man.
Eric, I'm like,
that's my dude.
I'm like, Bill, who's Eric, right? We know a lot of men by the name of Eric.
Yeah.
So yeah, hopefully Eric will be able to join us.
So shout out to Dr. Hodge. I asked him, I gave him the information that what I do, what Malika and I do on Real Talk Chronicles. Yeah. And I asked him would he be on, and he said he would love it. So we're going to reach out to more specialists and doctors in different fields.
That's great.
Yeah, and come and give you the best content we can. So, I know a lot of you, you got a lot of mouth shit going on.
Exactly.
And you wonder why your breath stink or your don't stink, but you wonder why this tooth is longer than that one and stuff like that. It's what's going on in your mouth, hereditary and things of that magnitude. So there's so many different culminations of stuff. Yeah. So why not bring a dentist in here to tell you what's going on instead of looking in the mirror and being confused? So right now you can sit here and gargle with Listerine all you want, but it don't make it right. Right. You know what I'm saying? Yeah. You gotta get you a doctor, a dentist. And that's not why he was there. That's not why. No, hell to I just want to be clear. My vanity game is tight. Just to be clear. One of my sins. I got to keep them right. I was just thinking I may need to get my doctor, Linda, the one that you met. I will not say her last name. Yeah. We got to get her on. We're gonna try to just have a smorgasbord of doctors, and just spew them out to everybody. Bop. No, I mean it's great information, right? It's good. Sure. I have a friend of mine. I might get a foot doctor on too, because some of y'all walking different. You know what I'm saying? Yeah, I need to check out your toes. That's all right. See what's going on there. You keep them covered all the time. Come back. Listen, everybody. This is Real Talk Chronicles. This is Real Talk with Dr. Theresa Mack. This is Real Talk with Malika Forster, and I am the one and only. The one and only. Yeah. So we won't be here Wednesday unless we do a hard cut at 8:00. But I might be here Wednesday if I can. I don't think I will unless Malika wants to come and do whatever. I'm sorry, I already have plans for Wednesday. You do it. I forgot to tell him. For the betterment of the community. I have plans for Wednesday. Exactly. It requires laying out. So Thank you, Marlene. Exactly. Good. Marlene, I'm looking forward to seeing you. It's been way too long. Absolutely. Stefania, I'm looking forward to meeting you in person. It's definitely been way too long. Hodges. Yes. Hodges. Yes, Dr. Eric Hodges. Eric with a C. Talk about a stress reliever. I've been playing with my stress ball. Yeah. I got it. Oh, let me keep it PG. It's time to go. PG, baby. Yeah, exactly. So everybody, thank you for joining. Malika, thank you for tuning in. I'm Bill. The Forsters, Forster the Moment with positive vibes only. 4-star General Row House. Check us out. See you soon. Oh wait. What? Stefania, she says she's coming in July. Oh, knock it off. Girl. Wait. I that's when they say I want to see it to believe it. All right, you got to let us know. Message Bill, message me which Sunday in July you're talking about to make sure I'm there. I will skip the beach to meet you. I'll tell everybody that. I will skip the beach to come meet you. I'm gonna have to hit Stefani with this.
Oh, geez. No, please don't.
Oh.
All right, she said she's serious. Let us know.
All right.
All right.
Bye,
Bye
guys.
everybody. Talk to you later.
Have a wonderful.
See ya.
Peace.